Hello everyone, my name is Junawisi Ontowa, BSN1 from Section 11N. And today, I'm going to perform Assessing the Abdomen Return Demonstration. Assessment of the abdomen consists of inspection, auscultation, percussion, and palpation. The physical examination of the abdomen is the case step in the evaluation of abdominal complaints such as pain, distension, and large organ or masses. Prior to the conduct of the procedure, first thing to do is to review client's previous medical records if available. Next is to prepare the necessary equipment needed to conserve time and energy. The equipment that I'm going to use include tape measure, ruler, and of course the stethoscope. Now perform a hand hygiene to protect the patient and also myself from infection and cross-contamination. Good morning, ma'am. My name is Junamisi Ontowa, your student nurse for today. Can I see your wristband, please? Can you state your full name, ma'am?
I'm Honey Jean M. Castro,
And your birthday?
June 23, 2002.
Okay, thank you. And what do you want me to call you?
Just call me Mom.
Okay, ma'am. Today, I'll be assessing your abdomen, which means I'll have to expose your abdomen. I'll have to listen your vowel sounds and also feel for your internal organs. Will that be alright?
Yes.
Okay, so is it okay to close the door so that no one from the outside can disturb us while doing the assessment? So before we start, I encourage you to void first so it will be much comfortable for you while doing the assessment. Ensure that the patient has emptied his bladder prior to the conduct of the procedure because a full bladder can make an examination uncomfortable and it can reduce the accuracy of the bundle height measurement. Now, position the client in a supine position with arms folded over her chest or by lying at his side and then place a pillow underneath the patient's knees. This position ensure the abdominal muscles relaxation to avoid additional pressure on the patient abdomen. Now, cover the upper and lower body parts of the patient, leaving only the abdomen exposed from the xiphoid process due to above this symphysis pubis. Do you feel any pain in your abdomen, ma'am? Okay, so I'll begin inspecting your abdomen first. Begin with the inspection of abdominal skin characteristic as is for the abdominal skin temperature color. Note for any vascularities and stray or stretch mark, and also note for any scars, lesion, or rashes, and if there's any document or its history and its location by quadrant. Now, inspect the umbilical location and color and contour. The umbilical skin tones is similar to the surrounding skin tones or even pinkish if it should be recessed and inverted. Or protruding no more than 5 centimeters, and it should be round and conical. So now also observe for any presence of masses or bulges suggesting ventral henka, which is any protrusion of the intestine or other tissues through a weakness or gap in the abdominal wall. Now, observe for abdominal contour Now to observe for abdominal contour and symmetry while the patient lies supine on the bed, sit beside the client and look across the abdomen at the level slightly higher than the patient abdomen. Okay, and then now stand at the foot of the bed and observe for any abdominal symmetry. So the abdomen is normally flat, rounded, or xiphoid, in which is seen in thin adults, and it should be evenly rounded and symmetrical. So while doing the inspection, also observe for abdominal respiratory movements or tick, pulsation, and peristalsis. Now measure the patient abdominal while placing the measuring tape around the patient abdominal and at the level of the umbilicus. Proceeding now to auscultation of the patient's bowel sound. Auscultate for abdominal quadrants for at least 1 minute each, starting from the right lower quadrant and the proceeding in a clockwise pattern, noting for the intensity, each, and frequency of the vowel sound. Now, to listen the vascular sound, use the bell of the stethoscope and listen for bruises over the abdominal aorta, renal, iliac, and femoral arteries. Now to listen for peritoneal fraction, Rod use the diaphragm of the stethoscope to listen for fraction rub over the liver and spleen. Proceeding now to the percussion of the patient's abdomen because several areas in each of the four quadrants to determine presence of tymphaty or dullness. Now percuss for vertical liver span at the midclavicular line. Now percuss on the right midclavicular line of the area of lung resonance around the intercostal space and percuss downwards to the liver and note the change from the lung resonance to liver dullness and mark this one. Now, for vertical liver span at the mid-internal line, starting just above the umbilicus, percuss upward toward the liver and note the change from the tymphaty to dullness and mark this. Now for the upper border, start percussion at the body of the sternum along the third intercostal space and perhaps downward until the tone changes from flat to dullness and mark this. Now measure the distance between the 2 points. To assess for liver descent, ask the patient to take a deep breath and hold it for a while, percussing from the right lower quadrants toward the liver, and note the change from tymphaty to dullness and mark this point. Okay, ma'am, can you exhale, please, and hold it. You can scale now. And now measure the distance between the lower border at the right costal margin along the mid-clavicular line. To assess for the spleen and evaluate for splenomegaly position, the patient in a right-sided lying position with the left knee flex and identify the left anterior axillary line. To assess the sides of the spleen, percuss the left anterior chest wall roughly from the border of the cardiac dullness at the sixth rib to the anterior axillary line and down to the costal margin. Percuss the lower interspace and the left anterior axillary line, then ask the client to take a deep breath and percuss again. Perform the liver blood percussion to assess for liver tenderness. And place the left hand flat against the lower anterior rib cage and use the ulnar surface of your left hand to strike the right hand. Okay, ma'am, do you feel any pain? Perform the kidney punch to assess for kidney tenderness. Reposition the patient in a sitting position. And then place the left hand at the costal vertebral angle over the 12th rib. Use the ulnar side of the right first. Strike against the left hand and ask for anything. Ma'am, do you feel anything? No. Okay. Now, do you feel anything? No. Test for scientist. Test for shifting dullness while the patient is in lying supine on the bed. Percuss the flanks of the patient from the bed towards the umbilicus, rating the change from dullness to tempathy and mark this point. Now reposition the patient to a side-lying position and perhaps the abdomen from the upward and rating for the change from dullness to tempathy. So for fluid wave test, while the client is lying in a supine position, ask the client to press the edge of his hand firmly down the midline of his abdomen. Ma'am, I need you to place your hand here and press it down, please. Thank you. And the top one flank sharply with the fingertips to feel for fluid wave transmitted across the abdomen to the opposite flange. Okay, thank you. Perform light palpation to assess for tenderness and presence of mass with the client lying relaxed in supine position. Begin with a light systematic palpation of all the 4 quadrants or 9 regions using the finger pads, initially avoiding any areas that the patient had identified as painful, and then observe for report of pain, tenderness, guarding behavior, and masses. And now perform the palpation, which is done to feel or internal of the internal organs and masses. Compress the abdomen to a maximum of 5 to 6 centimeter using the palmar surface of the hands, and initially avoiding the painful areas and palpated for muscles resistance or masses. Perform moderate palpation at the umbilical ring, noting for any presence of masses, swelling, granulation to assess for tenderness and presence of masses. Palpation of the abdominal aorta. Use both hands to deeply palpate the pedestrian slightly to the left midline. Now palpate for the liver to assess for liver contour, surface, presence of nodules, tenderness, and irregularity. Place the left hand under the client's back at the level of the top, 11 and 12 ribs, while the right hand is laid parallel to the right costal margin with fingertips pointing towards client head. Instruct the client to take deep breath, then compress the fingertips toward and inward to the lower border of the liver and causes for contour, surface, presence of nodules, tenderness, and irregularity. Ma'am, please take a deep breath. Again, please. Last one, ma'am. Okay, thank you. Okay, now perform the hooking technique. Stand at the patient right side facing his feet. Press in and upward the costal margin with your fingertips and ask the patient to take a deep breath gently and firmly. Pull inward and upward with the fingers. Palpate for the liver edge as it descends to meet the fingers, noting to contour surface, presence of nodules, tenderness, and irregularity. Ma'am, can you take a deep breath, please? Okay. Again. Okay. Last one, ma'am, please. Okay, thank you. Percast the spleen and assess for splenomegaly. Stand at the patient right side and reach over the patient abdomen. Okay, reach over the patient abdomen with the left hand under the posterior lower ribs and pull up gently. Place the right hand below the left costal margin. Press in toward the spleen. Ask the patient to take a deep breath, then press inward and upward using the right hand, as the left hand provides support. Begin the palpation below the costal margin and try to feel the tip of the edge of the spleen as it comes down to meet the fingertips. Note for any tenderness and assess the splenic contour. Ma'am, can you please take a deep breath? Okay. Again, please. Okay. Last one. Okay. Thank you. Okay, repeat the procedure with the client lying on the right side with legs somewhat flex of the hips and knees as needed. Ma'am, I need you to turn at your side. Okay, take a deep breath, ma'am. Okay. Again, please. Okay. Last one, ma'am. Okay. Palpate the kidneys to assess for kidney enlargement. Stand at the patient right side. Place the left hand under the patient right posterior flank and the right hand at the right costal margin at the clavicular line. Instruct the patient to take a deep breath and compress the fingers during peak inspiration, and then ask her to exhale and hold her breath briefly and gradually release the pressure on the right hand to fill the right kidney, keeping beneath the finger. Ma'am, can you please take a deep breath and exhale and hold your breath, please? Hold it for a moment. Now, exhale. Okay. And inhale, please. And you can exhale now. Last one. Okay. Palpate the left kidney with the procedure reverse state the urinary bladder. Begin the palpating at the synthesis pubis and move upward and outward to estimate the bladder borders. Test for appendicitis or peritoneal irritation, rebound tenderness, or Bloomberg sign. Palpate deeply at 90 degrees into the abdomen, halfway between the umbilicus and the anterior iliac crest or the mock burnish point. Then suddenly release the pressure. Listen and watch the client expression of pain as the client to describe which hurt more, the pressing in or the releasing, and where the abdomen the pain occurred. Okay, ma'am, did you feel pain while I was pressing your abdomen?
No.
Did you feel pain when I released pressing your abdomen?
No.
Now for referred rebound tenderness or rub inside, palpate deeply in the left lower quadrant and quickly release the pressure. Okay, ma'am, did you feel pain while I was pressing your abdomen?
No.
Did you feel pain when I released pressing your abdomen?
No.
Test for psoas sign. Reposition the patient in the right side lying position and then hypertext the right leg. Okay, ma'am, tell me if you feel any pain. Do you feel any pain?
No.
Test for rotator sign. Now support the client's knee and ankle and flex the hip and leg and rotate the leg internally and externally. And now, hypersensitivity test. Using a sharp object, stroke the patient abdomens these several times and note for any complaints of pain. Ma'am, are you feeling a pain in your abdomen?
No.
Do you feel any pain?
No.
And now, test for Murphy's sign or test for cholecystitis. Press your fingertips under the liver border at the right costal margin and ask the client to inhale deeply and note for any increase in painful. Ma'am, please inhale deeply and hold it. Okay. Do you feel any pain?
No.
Deep? Okay. Do you feel any pain?
No.
Okay, ma'am, that we are done with assessment of your abdomen. Here's the summary of what we are just have done, okay? Okay, so upon inspection of your skin, your skin is in uniform, no rashes, no lesion, no scars, and your umbilicus or your navel is midline and inverted, which is pretty normal. Your abdomen is symmetrical, and upon auscultation of your bowel sound, while I was listening to your abdomen, the sounds are pretty normal and I hear no bruise or venous. Okay, so while I was measuring for your liver size, your liver span at the mid-clavicular line, here is I measure it, is it 7 centimeters, and while I was measuring for your liver span at the mid and sternal line, it is measured at 5 centimeter with falls within the normal range. Okay, so upon percussion and palpation, there were no tenderness, no masses, no bulges, no swelling. Overall, your abdomen is doing pretty good. Okay? Do you have any questions or clarifications? So overall, your abdomen is doing pretty good, but before I leave, I will give some advices on how to keep your abdominal internal organs healthy, okay? Okay, so first, as much as possible, avoid from drinking too much alcohol or hard liquor because it may cause damage for your liver. And instead of drinking alcohol, might as well increase your fluid intake such as water to flush out unwanted residues in your liver or on your blood during your intestines, okay? Okay, and if you have any urge to pee, then do not hold back or do not delay because holding back your pee might cause the bacteria to multiply and can cause serious disease such as urinary tract infection. Okay? Okay, that's all. Do you have any questions or clarification before I leave? Okay, that would be all, ma'am. Thank you for your cooperation.